question.
Okay, could I start?
Just 25 seconds.
No, 1 minute. After 1
Yeah.
minute.
Right now, if you have read and understood, considering it communication skills station, kindly please begin. Begin
Okay.
now.
Hello.
Yes.
Hello, I am Dr. X1 of Surgical Dr. He. Can I confirm your name, please?
Okay, so I am Mr. X. I am 50 years old.
Hello, Mr. X. Nice to meet you. I have been told that you want to leave the hospital. Can I know why, please?
Okay, doctor, stay hospital is frustrating and disappointing.
Yes, I understand that. I know that staying in the hospital is difficult for you, but I want you to know that people kept in the hospital when absolutely necessary. Okay, no problem. Can you please tell me how far do you know about your condition, please?
Okay, here they explain me I have some hematoma in the spleen, so I have to be hospitalized.
Mhm. Okay,
I
let me
have an
explain. Okay, let me explain to you about your case. You came after RTA to the hospital and you are complaining of the rib fractures on the left side. Also, you are complaining of the splenic hematoma. The spleen, it is the organ that is present in the left of upper your tummy, as here. And about the hematoma, it is the collection of the blood around the spleen that became hard and may be sloughed at any time and making bleeding. Also about your hemoglobin, it is decreased from 12 to 10, that's mean you lost 2 grams, and this is mean there is bleeding, and maybe this indicate that it's dangerous for your life.
Okay, doctor, but my wife has an appointment today. She has cancer.
I am so sorry for that, but I need you to see to your own health also, as any bad happening to you, your wife's condition would be more worse. I can contact with our social worker to find any way to help your wife.
Okay, doctor. So I have a job interview as well. So I cannot stay in the hospital.
I can understand that the work is very important for you, but I can help you and call your work and explain your case and try to making another interview for you when you are covering all your health.
But still, I want to go home. I don't want to stay at the hospital.
Okay, Mr. X, please, can you tell me repeat what I told you to see if you are able to understand me right or not? Can you repeat what I told you?
I understand you, doctor. I have a problem in my spleen. I have hematoma there, and it might endanger my life. But still, I cannot stay in the hospital.
Okay, Mr. X, I can't discharge you medically because continuous admission it's advised for you, but if you want to discharge, you assign a legal document. This legal document that explain your case and all details about your case and all potential sequence discussed with you, and you will take full responsibility for any adverse outcome for you. It's okay for that with you?
Okay, doctor, I will do so.
Okay, so Mr. X, please let me tell you about the warning sign. If you are feeling, if there is any sign of this sign, you should to go directly to Nairobi Hospital for you or back to us. And if there is any pain in your tummy or feeling drowsy, please, you should directly go to Nairobi Hospital or back to us. Also, I need you to promise me don't drive alone. And should you have a company back to home?
Okay.
It's clear for you?
Yes, it's okay. I understand.
Okay, Mr. X, you are decide to discharge yourself, and continuous admission was medically advised for you, and you are going to sign a legal document that you will take full responsibility for any adverse outcome for you. Any other question you want to ask me, please?
No, it's okay.
Okay, I will leave my number to the nurse. Please, if you want anything, you can call the nurse to call me at any time. It's okay?
Thank you.
Okay, Mr. X, thank you.
You still have 2 minutes. So one, you can discuss that, doctor, I have an interview tomorrow for my pay rise. That's why I cannot stay. I must go home.
Okay, doctor, I have an interview, job interview tomorrow, so I have to go home. I cannot stay at the hospital.
Yes, I can call your work and make other interview for you and explain your condition for your work, because it is continuous admission in the hospital. It's good for you, not good for go to home at time now. As I told you, you have the splenic hematoma. Maybe slough it at anywhere, any time, and making the bleeding, and this is maybe dangerous your life.
Okay, doctor. But
You can
still,
ask me what is the hemoglobin. Maybe ask me what is the hemoglobin also.
So what is hemoglobin, doctor?
It is the blood indicator that carry oxygen. When it's decreased, that means there is bleeding anywhere.
Okay, doctor. But I don't feel any problem right now. I think my pain is subsided, so I'm okay now.
Yes, that is false sensation of being safe. It is false sensation of being safe.
Okay, doctor.
Good. Just last 30 seconds left if you're completed.
Okay. Maybe my exam ask you are away from the hospital, so you can calling the ambulance. If you leave away from the hospital, you can calling the ambulance.
Okay, doctor. Can you please help to call an ambulance? Can you please assist?
Okay, if you live away from the hospital and can't go to the hospital, please call the ambulance.
Okay.
Okay. If patient asks you if I can, bell has gone, right? If I can go back, because in this scenario, in this station, you are requested or you are advised to convince the patient to accompany someone back home. But if patient asks you that, one, I want to go home against medical advice. Secondly, I want to go home by train. Would you allow your patient or not?
Okay, about the train, it's good to go to the home by a company. It's good than the train, because the train
by
is
taxi.
more
No.
vibration. Or
By taxi, not by train. Because
yeah, because
public trains,
a lot of It is a lot of vibration in the train.
Yeah, a lot of people, and there could be jerks, and there could be like a rush or whatever, like there could be like problem for the patient. It could be pushed away or something, so which could be life threatening. So it's better that you'll say, okay, if there's no one to accompany you, then we can help you arrange, or you can arrange yourself taxi and go by taxi rather than traveling by train. Good,
Mhm.
good, excellent.